Why is so much medical care so expensive, though? Because my understanding is that they just bill really high, expecting the insurance company to negotiate it down. And like, that's the only reason why.
Well, there's a lot of components to that. So the one thing you mentioned right off the bat, there's a middleman, an intermediary, and they have a lot of salaries to pay for along the way as well. So an insurance company is designed to be profitable, even though they're really not. They're subsidized a lot by the government, but they have a lot of admin they've got to pay, and they've got a lot of people that are making phone calls they've got to pay. So there's a lot of leak in the finances that goes along there as well. That's one component. Right. The other component is you're dealing with. So think about what it would cost to run a hospital. Imagine what the electricity bill is. Your liability insurance just for slip and fall.
Sure.
What you're paying your entire staff everywhere, and then you add the litigiousness of the healthcare system as well. To where when people sue hospitals or large industries, it's better for them to just settle than to take this all the way to court or damage their public opinion. For small providers like us, we'll just bankrupt the company and start over again. We're not going to deal with that. But if you're a large hospital or something like that, you're just going to basically pay people to go away or shut up and sign an NDA. So that cost is passed back on as well, whether it should have been settled or it shouldn't. I'm not there to decide that, but that's a cost. They'll argue that R&D is a big part of that as well, that it costs a lot of money to come up with a surgical screw, or it costs a lot of money to find the right titanium blend, or the cost to develop a drug. So that money should be built back into the equation as well. And I'm not sure they're wrong necessarily. I'm a devoted capitalist in general, but I think there's a couple places where socialism is a better fit. And to me, I think that's actually for healthcare that people have to have. And I think for education, I don't think that unfettered capitalism, in those two areas that make society better is the best idea. That, a college could just keep running up the tab and could cost you $1 million a year with no guarantee that this degree will lead you anywhere. And then it's just between you and the federal government. I think healthcare is another thing that you're not entitled to somebody else's labor or time, which is sort of what healthcare is, right? These doctors went to school for 12, 13 years, so they should be compensated. But I think the problem is cyclical. So here, let me rewind this whole way back. So they're just expanding this now. So going back to medical school, they can expand more medical students. They don't, like nurses, like they can't get into nursing school even though we have a shortage. So there's Medicare pays for residency placements. They pay salaries for residency placements. Medicare doesn't have a ton of money, right? It's essentially bankrupt. There's not a lot of money there. So they're paying the salaries for the resident doctors that are making 50, 70 grand a year. So they can't expand more spaces even though our population is growing. So these medical students graduate med school and now there's no places for them to match into residency. So because of that, the medical schools don't want a ton of graduates graduating that can't get placed into residency and sitting there. So they're going to have to cap how many students they're bringing in as well. Well, with inflation and, some of these medical schools are for profit out there. They're going to jack the tuition up to make up the difference because they're not able to increase the amount of students that they get in. So it's kind of bottlenecked on the far end, from the residency placing programs as well. So now these doctors are coming out with $400,000. I think the average is like $300,000. I think in student loan debt now at 6 point something % interest that they have to start paying even though they're making minimum wage or less essentially as a resident. And that's going to influence some people's behaviors.
Wow.
Even chiros, so I refer out for all imaging, but some chiros have an x-ray machine in their office, right? So you have to pay for the machine. You've got to pay for the OSHA. You got to get lead in the wall, all this other stuff. So if you're on the fence if your patient needs an x-ray or not, do you want the bias that you're having to pay for your x-ray machine to be factored into your decision-making? Because I'm not sure how many humans could completely separate those two things from each other. Yeah. Right? They have medical debt. They have kids in school. I think as much as you'd like to think that every single person would always make the ethical decision, I don't think that's reasonable to expect out of every single person. So when you saddle doctors with $400,000 in student loan debt, I think that incentivizes certain types of behaviors. I think it pushes them to types of procedures that are cash-based, whether they're Botox or, stuff like that, and away from Medicaid paying for family doctors or for pediatricians or people like that.
What's the solution to that? It just seems like maybe the Canadian system is a little bit better where they have higher taxes, but healthcare is available to anybody on a first come, first served basis. Is there something that you would suggest that might make it better?
I don't know. I think just like anything, if there was an easy solution, we'd have it. Is there an easy solution to immigration? No, you could see both sides. So I think for wealthier people, there's no better place in the world you can get healthcare than the United States of America. In Canada, if you want something outside the system, you're going to have to wait a really long time. Yeah. Also Canada is a significantly much less demographically diverse country. Economically and ethnically and religiously. So I think those countries that have small populations and lots of money, they're able to do things that bigger countries like the United States or Brazil can't do. New Zealand and Canada and some of these places, Norway, that we compare. I mean, you're talking about small countries, low population, homogenous, very wealthy. You don't see areas like Detroit or New Orleans or Baltimore or even Albuquerque in Norway or New Zealand. You don't have that wealth disparity. And there's a lot of people that fall into those categories. And how do you take care of them? Again, I don't know. I don't know what the answer is. I think the best innovation and technology and all those things come from the United States for the most part. Some of that is because of capitalism. We incentivize researchers to create, brand new robotic surgeries or medications or things like that, because capitalism is incentive by nature, right? Like you're going to fight for the best product, but there's a downside to it. What's a better solution? I don't know. Like, democracy has problems, right? Do we think that the most amount of people should be making decisions? I mean, that's sort of how the Salem witch trials happened.
Right.
And that's how, a lot of the horrible things in history have happened because more people said that it was okay.
Right.
But what's a better system than that? I don't know. Nobody's come up with a better one. So I don't know. We need reform, and it could be that you fix one thing and it creates a leak somewhere else. And most things tend to be that way, that the best laid plans don't work. I just know that in a country this wealthy, we shouldn't have as many people going bankrupt over their bodies or their healthcare. Now, circle back around, you could say, hey, we don't take care of ourselves very well either. So we're 70% obese. So we're paying a lot of money for lifestyle medicine, for diabetes care, for people like me that eat a lot of processed food that ended up with ulcerative colitis that I have to take a medication every month. We make a lot of bad decisions, and that might be a byproduct of our Americanness, of wanting to do what we want, of having lots of money to where we can smoke e-cigs all day, or whatever that is that we know is bad for us, but we still do it. That we end up having to pay for those lifestyle behaviors and activities down the road.
Right.
I don't know. Like, we should know better, but we still smoke, we still gamble. We, as a society, we still make things and decisions that are harmful for us, that are going to cost us down the line. So then what is it? We authoritarianly don't let people do those things? Freedom is important too, right? Like, freedom to choose what you want to do with your healthcare, I think, is really important. In EBM, or evidence-based medicine, there's three components. There's literature, there's the clinician's, intent or recommendation, and there's the patient's willingness to be a part of that. So if the patient doesn't want to do it, it's not EBM. So they have to be part of that. They have to buy into the treatment. They have to buy into whatever it is, which requires freedom.